have a sit down with Dr. Joseph Sitonik. He's the CEC Health at Bomet County. We have toured this facility, and indeed they are doing a lot, especially when it comes to responding to a COVID-19 pandemic. But without further ado, I'd like Dr. to just introduce himself just a bit before we delve in to matters status COVID-19 in Bomet County. Dr. thank you so much for availing yourself and giving us this amazing opportunity to just have a word with you and get to understand the status of the pandemic in the county. But just briefly introduce yourself, please, Dr. Sitonik.
Thank you. Welcome. My name is Dr. Joseph Sitonik. I'm the CEC member for Medical Services and Public Health, County Government of Bomet. I'm a medical doctor by training, and I understand quite a lot that happens in hospitals. And I'm very glad that you are able to visit us today and see what we are doing in terms of our health at our county Faro Hospital, and especially at this time when we have COVID-19, the pandemic. We are no different from everybody else. We are struggling with it, and we are doing the best that we can. Thank you.
Before we talk about Bomet County in particular, I know you've been involved a lot, especially even when it comes to government's, national government's response to the pandemic. What do you make of the response so far, despite all the challenges that we've had as a country?
Yeah, I think given the situation that we are in, I think our government, both national and the county, have really tried. This is something that had not happened before, but quickly we have coalesced into one unit, and we are responding, sharing between the national government and the counties, and even between counties. So we are glad that when devolution came, there is intergovernmental relations. I think through that mechanism we are able to exchange a lot, we are able to coordinate and even respond together. And we are very happy that this has been, I think if it was not for the good effort that both levels of government are put, we would be in a worse situation. Yes.
Now zooming into Bomet County, what would you say is the current status of Bomet County? Do you have a lot of infections or generally what has been happening for over 1 year since the first time the country, the ministry announced that COVID was actually in Kenya?
Yes, initially we had very low numbers, and I must say the initial response even in our communities was quite very impressive. But over time, we have also realized that our numbers have really come up, and we've even overtaken some of the counties that were ahead of us. And if you look at the way the wave, it was initially Mombasa, then Nairobi, Kiambu, Nakuru, and at the moment we are now talking of the Lake region, which we are part of. And if you look at the numbers that we have, they've started going up. So currently, the numbers that have been tested, we have around 732. Yet, about a month or two ago, 2 months ago, we were 400, 500. It's like the numbers have really increased. Luckily for us, the response has been mainly on prevention, but we have been unlucky because we've lost about 60 patients since the pandemic started, 60 of them, and we really, we have our condolences to the families that have been affected. So our initial response was actually the issue of coordination. The national government officers led by the county commissioner and our governor are the lead in terms of engaging committees, different committees that deal with the issue. So we have an emergency response committee at the high level, and then we have committees that are, like we have a medical committee, we have a surveillance committee, then we have a market committee, because we realize that some of the problems that we have deal with the people who on a certain day in a week they congregate in markets. So we thought we needed to have a team that is comprised of people in the urban setup, especially in the Department of Lands and Urban Setting, urban lands, and then we have the security officers and our Department of Trade. That forms a committee so that they can approach the traders and the business people on what to do on that. And then the medical are mainly my department, where we give reports on the constant occurrences. And then we have the surveillance that tells us of any events. We don't want just to say there's a case here. We also monitor events. Whenever there is an issue like a burial, if there's a death that is unexplained, there are people who monitor that and give us that information, and that could be a sign that something is happening. So I'm happy to say that this committee, especially led by the governor and this county commissioner, meets every Thursday, unless when other meetings take precedence. They meet every Thursday, and they will give each other reports and responses on what to do.
What would you say are the main challenges that you're facing as a county in terms of combating COVID-19? Now that you're saying that the numbers are escalating, they are more than maybe a month ago. What are some of these challenges that the county is facing in ensuring that the citizens is safe?
One of the initial things that we noted when this problem started was the issue of stigma. We realized that people who were coming into the country were seen as the ones bringing. So that has driven stigma to some level, to the extent when now it's in the community. When they see you unwell and you've been admitted in an isolation, people shy away from you or your relatives. In fact, those early days, we had one patient who came from abroad, and people never went to their shops to buy. Yet that patient was not even, that person was not in that, they were on home isolation. So that stigma has been a problem, and stigma tends to hide. People don't come up with the information, you know, they shy away because they fear. And sometimes the numbers we report may not be exactly the numbers because of that stigma. The other thing that we had initially was people giving wrong information, misinformation. I think that's been a challenge. We see this even in people talking casually, even very responsible people giving a statement saying, this thing is not there, we've not seen somebody dying of it, or we've not seen anybody getting this infection. And then the social media has also driven this one, because somebody just posts something that is talking negative about their approaches. And then the other challenge, I think, has been sometimes the PPEs can be a real challenge. Like currently, if you look for gloves, you will not get it. They're out of stock. And then, you know, the whole country and the whole world were looking for the same things. Yet they are not coming from us, we were importing. So there was a time when we had those. But we want to thank some of our stakeholders, like Equity, when they brought these supplies, and they were specifically meant for certain facilities that would take care of a high volume number of patients. They were able to really help us. The flow of funds sometimes is a challenge, because you realize that we've not received funds for quite some time. Yet you are expected on a daily basis to have the necessary things. That has been the other challenge. The other challenge also that we faced was when now infections hit hard on the medics, people tend to run away or fear. I must say in Bomet, we were thinking that this COVID would come through or would come to other people. Unfortunately, the first people to be hit was our staff. And that really woke us up and said, this thing is real. Some of the first patients we admitted in isolation were our own county staff. And coupled with the challenges of PP sometimes, and salaries issues, and the usual issue of unions, that has been slightly disruptive. Because while you really are trying to think of what you need to do for this person, the union also come in, and they have a genuine reason. Lives are being put at the front line. So that has been a bit disruptive, but I'm happy because in Bomet County, we've been able to talk and negotiate and circumvent some of these challenges. I know the other thing that comes in is protocols sometimes change. You know, we are talking today, tomorrow it has changed. That has been the other thing, that protocols keep changing because the whole world is learning. Like the way we were handling dead bodies or dead people is not the way we are doing now. We were almost going in and invading those people and disposing the bodies and running away. But nowadays, especially for Bomet County, we have said when a death occurs, we want to go and mourn with the family first, plan with them on what to do, and let them know the part we play and the part they can play. So we've been able to be friendly with the families. Initially, they were, when we went with the suits, you could see from the eyes that they want to chase you away. Yeah, but nowadays when we go and discuss with them and plan with them and even do the burial, supervise the burial, sometimes we don't even need to be us. We want the family members to participate, but we give them the attire that we are using. And we've gone on well. Even those 60 that we've had, I think we've managed to bury, we under supervision around 50 something, maybe 56. Yeah, and there has been no major issue. So the challenges are many. Yeah.
But when it comes to the nurses, the frontline, the health workers are the frontline soldiers that we have when it comes to COVID-19. So how did Bomet County deal with that issue? Here you are, there are not maybe enough PPEs, but still we need to treat people. How did Bomet County face that challenge of scarcity?
Yeah, I think one of the key issues that we addressed, and this was a plan even from the national government, was that people needed to be sensitized. People to know there's something. And then training now. You go now to the details of what you need to do in terms of protecting yourself, what do you do in certain circumstances, what appropriate measures do you need to do, like which PPEs do you need to put in a general ward or in outpatient department where people come and you don't know whether they have COVID. And then in case you are now going to areas that you know you are dealing with patients who are infected, what precautions do you need to make? So there was that element of training. And then we were also assisted by the county government and the national government in terms of the numbers of staff. Our county employed 82 additional staff, mainly for COVID, and their contracts were 3 months and they have been renewed throughout. So every 3 months we renew the contract. So that number has boosted so that you don't have fatigue in terms of patients' care. And then the national government also, through UAC, supported us. We got quite a good number, I think over 100 number of staff, different cadres, from doctors, lab, public health, nutritionists, psychologists. We got all those, and they came and boosted that. So the numbers was our initial challenge. We don't have enough still, but without that support, we would not have had that. And then the national government, I mean the county government, actually froze all the other projects and channeled money to health. You know, we are dealing with COVID and the other conditions, so we didn't stop. Instead, we were boosted in terms of the resource, so that we double up in terms of the requirement. If it is drugs for hypertension, drugs for TB, we wanted those services to continue. And you see, there are things that are used when you are dealing with TB or even COVID, like gloves, the masks. So we were given more money. I think our county government voted in around over 150 million. So even when the money from national government, the COVID funds came in, which we got 115 million, we already had our county assembly had already appropriated 150 million to deal with that. So we initially bought equipment and things like that. Yes.
So did you face a situation where, due to COVID, people are afraid and the people have other conditions that they actually need to come to hospital and be treated, but because they are afraid of COVID, they would not want to maybe come
yes.
to get treatment?
Yeah, we did. We did have, but we tried to sensitize. Like we went to radio during public, but others, because those days at least we could still meet, we told them that other services are running. But if you look at some of our clinics, numbers were down, but we were giving people additional drugs for several number of days, unusually longer than before. So we had, like if you look at diabetic clinics, hypertension clinics, the numbers went down. Luckily for us, the immunization didn't drop so much, because we have the community health volunteers who were going around to telling people that you still can get this service as long as you protect yourself.
The hospital and Bomet County has been the talk of town, and people are really glad. But as we were talking earlier, you were telling me this plant has been there. How has COVID-19 maybe boosted its utilization?
Yes, this plant has been there, but we made it more productive. I mean, in terms of capacity. Our county government has added a compressor that is bigger, is able to do more work. It produces around 9,000 liters per hour. COVID came in, and we realized that was our strong point. We initially were wondering whether we go for ventilators or oxygen, and we said, and with the advice of some of our colleagues in Mission Hospital, they said that this problem, if you have enough oxygen, you are able to save quite a number of people. People in ventilators can stay for months. One person can stay without ventilator for months, but there's a queue of other people who require it. So oxygen has been our strength, and we give it liberally. We have an isolation facility within the hospital and another one in Koiwa, and we are able to supply the two areas with oxygen using cylinders and a manifold where you go and fill the cylinders. When they are depleted, you come and get more. So you saw even in our plan that there were some that were already in place. Also, they are going to Koiwa, which is an isolation facility slightly far from here. So we have those.
How different is how we also know that Longisa, the plant at Longisa, is also supplying oxygen to other medical facilities outside Bomet County. Are they coming with cylinders? Because we've seen going around the hospital, it's piped, and patients are able to receive oxygen direct from where they are, not from the cylinders. So how are you able to maybe liaise with other facilities outside the county to ensure that they have enough oxygen?
Yes, we provide, like for our own facilities, 140 of them, we have cylinders, and there are some facilities that may be seeing mothers who may deliver around there. We have oxygen with small portable cylinders taken to them. We also have our ambulances. We supply oxygen. For the other people, like there are patients who depend on oxygen and they are using it at their homes. They come and we just fill them for them free. So everybody else comes with a cylinder. Like some of the facilities in our neighborhood bring their own cylinders, they are filled for them, and they go. We have not sold the oxygen to them because we know we are dealing with a pandemic. Yes. I think our governor said this is a humanitarian gesture from Bomet. He was even saying he wishes that the patient will not be charged. In fact, that the understanding that it's given, it's also given free for them. So people come with their own cylinders. Some ambulances have been crossing around here. Some of them get depleted oxygen, get depleted on the way. Yes. We've always told them to come, and some have come, and we refill the oxygen and they continue with the journey. Yeah.
You've touched something that has been also very pertinent, the issue of cost. You realize that when someone is critically ill, and maybe it's due to COVID-19, they'll require a lot of money to even get admitted, leave alone the entire treatment. What is your take on it? What needs to be done so that people can get treatment for COVID at affordable rates?
I understand the cost is really prohibitive. And I think one of the reasons is that people are depending on oxygen they get elsewhere. You can imagine if somebody is using 10 liters per hour of oxygen, or even 15, because I'm told it can go even up to 20 liters per minute, actually, not per hour, per minute. So if you are using such amount of oxygen, it means somebody has to be on the road all the time looking for that oxygen. So the cost also involves the transportation, apart from the gadgets that they use, apart from the staff. So it can become very expensive. I would encourage that each facility generates its own oxygen, and I think this is where we require support to go in. And even those who have improved on the capacity. If we had several of them, and luckily in Bomet we have mission hospitals that produce oxygen. So in Bomet County, oxygen is not bad because we have that in plenty. Tenuk Mission Hospital produces its own oxygen. Doctor also produces. But as we've said, we want to assist as much as possible. So I think one of the ways of reducing cost is to look at anything that drives the cost. Like if people are traveling far to get it, that could be one of the reasons. So if they produce their own, it could just be the electricity and maybe the maintenance.
Before we call it an afternoon, what would be maybe your call to people of Bomet County, because we have been ushered into a new normal. But before we talk about behavioral change, let's talk about there were reports that we might face a fourth wave of COVID-19. How prepared is Bomet County? Because when we were talking, you were like, even if it will require that the entire of Longisa County Referral Hospital be turned into a COVID center, that is something that you guys are open to doing.
Yeah, we've tried to look ahead and think ahead and say in most case scenarios what will we do, because we realize that if there's a flock of patients who require oxygen, the best that you can do is to give that oxygen. And being a hospital which has 160 beds, most of it fitted, every compartment has oxygen, we will think of worst case scenarios and say, if things really go very bad, we can say we distribute services elsewhere, concentrate on the COVID issues here. But one of the things that we want to do, which I think we can succeed, is really prevention. Yes. If people can listen to what we are doing, that it is this simple measure that even Mheshimiwa Kawe has always been saying, put on a mask. Don't go to overcrowded places. If you are in a crowded place, don't stay for too long. Make sure you sanitize after you come. If we sensitize and tell our people that these things can wait, life cannot, then I think we'll not reach a situation where we have to turn a whole facility into a COVID center. So I think the only challenge we are seeing is that the fourth wave seems to be showing signs. If you look at the areas that are affected, it is now mainly areas like Kisumu, Kericho, Siaya. These counties around there, like this thing seems to have moved in a way. When we could be part of it, because if you look at our numbers also, we are not very far from there. I want to appeal to people that they don't drop their guard. If you look at things, I think Kenyans also have, maybe there's some fatigue. Yeah. This thing has been coming and people are saying, the way it has always come.
What do you think about the new strain of COVID-19? I think around
3 or 4, yes.
Yes, have been discovered in Kenya, and maybe this might contribute to the fourth wave of COVID-19. How different are these strains from the previous one?
You know, we had the initial strain, which is still quite a number circulating. Yeah. But we are told the strain, especially the Indian one, seems to be more virulent. It affects people without you knowing. By the time you discover, quite a good number have been affected. Yeah. I think we need to be even more careful because, you know, there is the issue of vaccination going on. We hope that we can do more vaccination before this thing spreads. But luckily, we are told that the COVID is still effective for even those strains that have come, especially the vaccine that we are using, the
AstraZeneca.
So we are happy even in Bomet. The doses that we got, 10,000, we exhausted. I think we are only remaining with a few hundreds. Yeah, so people were ready, and we know that when you have a good number vaccinated, then the severity may not be that bad. You still catch some of these things, but the severity and the outcome will not be so that bad.
All right. Yeah. Thank you so much, Dr. Sitonik. Hopefully we get to come back here and talk of more good things that the county is doing. But so far, Bomet is leading in having proper response to COVID-19. Hopefully other counties can follow suit so that we ensure that this invisible enemy does not destroy us totally. Asante sana daktari for your time. All right, guys, you've heard it from Dr. Sitonik. Behavioral change is going to be very important, and citizens have been urged not to down their guard, and also if other counties would also follow in the footsteps of Longisa County Referral Hospital in terms of having their own medical oxygen production plant, this would be very vital in the war against COVID-19. Well, thank you so much for watching this session right here on KUTV. Hopefully we get to another county and get to understand what they are doing in terms of combating COVID-19. Thank you for watching and see you around.